happy Monday. We have the Office of Early Childhood here today. We've been getting a lot of requests for this presentation, so hopefully this is helpful for everyone. The Office of Early Childhood will be presenting on the revised Child Care Center and Group Child Care Home regulations. I just want to say that if you are a family child care operator, this will not apply to you today. You're certainly welcome, as always, to be here and listen in and learn something, but I don't want to confuse folks. So family childcare, this does not apply to you. You can have your morning back, or you can watch it on double speed in the recording if you really want. But of course, you're welcome to stay. I am going to welcome Commissioner Beth Bai, and you can see that she's on the screen with Elena Trueworthy. Welcome to you, and I'm going to let you kind of open it up and introduce your team. So, Commissioner, the floor is yours.
Thanks so much for having us this morning. We are ready to share some information with you and answer your questions around the regulations. These have been in process for years. We finally have passed them, and then that turns into bringing them to the field. And all of that takes time and their various steps. And Liz and Lori and the whole licensing team have been working super hard to sort of translate the regs into what comes out to you. And we're here to both bring you the information, but also listen to your questions and see how we can communicate better with you all on those regulations. And big gratitude to the field, because we had a lot of feedback. These regulations represent hearings and feedback and improvement over time. And Izzy, I'm glad you stressed that these are center-based regs, not family child care regs. And it's really a great platform to have more than 200 folks on the line. So we can get this information out, and we'll continue communicating other ways too. I don't know, Elena, if you want to add anything.
No, just underscore just how much work has been happening internally around this and the work of the licensing team. And we're happy that we're able to share this today. I know we'll get lots of questions, and we'll do our best to be able to support the field and all of you as these roll out.
Great. And Liz is going to take the lead on presenting. I'm sure Lori will chime in too, as they've been a great team. And Liz was a provider. She's been a licenser. She's been a licensing supervisor, and now she leads our licensing division. So she knows from where you come. So Liz, I'm going to turn it over to you.
Thank you. Always great to see you. Thank you so much. Lori's going to start by sharing our presentation this morning. Again, my name is Liz Porietti. I'm the licensing division director. I'm joined this morning by Lori Audette, who is the licensing program manager. And together we are going to share changes to the Child Care Center and Group Child Care Home regulations with you. As you know, the Office of Early Childhood is the state agency responsible for licensing child care centers and group child care homes in Connecticut. And this presentation will help you learn about the recent changes to the regulations that govern licensed centers and group child care homes. As Commissioner Bai stated, the work to update these regulations began many years ago. The changes are responsive to the feedback we received over many years from providers, parents, local and state officials, and our own licensing staff. We want to thank everyone who contributed to this effort by sharing their expertise, opinions, and suggestions to make these revisions finally take effect. Before I begin reviewing the changes to the regulations, I just want to share the mission and vision of the Office of Early Childhood. The OEC recognizes that child care providers share our vision of ensuring children are safe, healthy, learning, and thriving. And working together, we can achieve this shared goal. The licensing regulations are designed to protect the health and safety of children. Putting the requirements of these regulations into practice is a responsibility of child care providers and the Office of Early Childhood. And working together to do this will bring about the best outcomes for the children. So this presentation will discuss the key reasons why the changes to the regulations were made. The presentation will not review every single revision to the regulations, but rather will review the most significant changes. The order of the presentation follows the order of the regulation sections. and a full copy of the regulations, as well as a plain language summary of the key changes, may be obtained by visiting the OEC website. It's extremely important that program staff read the entire regulation to gain an understanding of all the changes. So, why were the regulations changed? Well, some of the new regulations clarify what's expected by a requirement to make it clearer to programs as well as to licensing staff. So a language change is not necessarily a new requirement, but rather spells out in more detail what the requirement has been and the expectations for compliance. This will help to support consistency when the requirements are applied. Other requirements have been put into place so they are in line with national best practice. Some previous requirements had been identified as unnecessary or overly burdensome, and so were eliminated or modified. And you'll also see that new requirements are necessary to protect the health and safety of children. And finally, some requirements were put into place to comply with federal requirements and enact changes that are required due to the requirements of a recently passed public act. So I'm going to begin by walking through the sections of the regulations and highlight the key changes. And again, as I said, both Laureate and I are helping to present this morning, so I will read I'll take you through some of the slides and she'll take you through some others. The first section contains the definitions of terms that are used throughout the regulations. Most of the changes contained in this section are technical changes. For example, the term child daycare center was changed to child care center. And some terms like disinfection and sanitized have been added so that there will be a common understanding of words used in the regulations. A definition for field trip was added to the regulations, while the definitions for program staff and staff were clarified. A field trip, for example, is considered an activity for enrolled children that is either conducted at an address other than the facility where the program is licensed, or conducted at the same address, but not in a space either inspected or approved by the OEC. Program staff means those persons 16 years of age or older responsible for the direct care of children, including alternate staff and volunteers. Program staff are considered teachers, the director, or any other staff member who has the potential for unsupervised access to children because of their placement or role in the program. Staff, however, are personnel employed by the program who are 16 years of age or older who provide a service to the program that does not involve the direct care of children or having unsupervised access to children. Visitor is a new definition in the regulations and is defined as a person who is not employed by a program, but provides a service to a program or child. A visitor neither provides direct care to children, nor has unsupervised access to children. This might be a librarian who visits the program and simply reads to children, but is never left alone with children or cares for children in any capacity. It might also be an outside contractor who's brought in for a special event, like a yoga teacher, for example. The regulations now specifically indicate that night care is supplementary care that is provided for 1 or more hours between 10 p.m. and 5 a.m. And this means that programs can provide care for 1 or more hours between those times, and they must meet additional requirements related to the care of children during the night and be issued a separate night care endorsement.
The next section is regarding the administration of a childcare program or a group childcare home. So one example of change in this area is the regulations previously required that programs discuss with children's parents the techniques used to manage child behaviors in the facility. The regulations now require that the program inform the parents of the techniques used. This is an example of a regulation being loosened to allow the program some discretion as to how they will inform parents. The list of techniques prohibited to manage children's behaviors was also expanded to include specifics like spanking, slapping, pinching, shaking, and striking children. The regulations no longer require that a change in fees must be reported to the OEC. However, programs must report changes in fees to the parents at least 30 days prior to the effective date of the proposed change. A change in legal representative must also be reported to the OEC within 5 business days after the change. Daily attendance records, for example, for both children and staff, including the time of arrival and departure, must now only be kept on file, excuse me, for at least 1 year rather than 2 years previously required. The content of the program's emergency plan now very specifically spells out in the regulations, which will serve as a guide to programs. A multi-hazard drill must be practiced at least annually, and you must make sure that all components of the drill is practiced at least annually. A program's general operating policies, excuse me, now must include a written plan for the administrative oversight of the facility, including who's in charge in the absence of the director. This information must also be posted in a conspicuous location, so parents have that information readily available should they need to discuss any administrative concerns. While this is a new requirement for postings, the regulation no longer requires that the fire marshal certificate, food service certificate, or emergency plans be posted. This is another example of changes to the regulations that were loosened. In the section regarding staffing and consultants, a few changes were made here. One is that medical statements for current program staff now only need to be updated every 3 years rather than every 2 years. And a TB test is no longer required as part of the medical statement. The regulations now specify that programs shall submit the necessary documentation and information necessary to complete comprehensive background checks on all staff that provides care directly to children or involves unsupervised access to children. This information is currently tracked in the Background Check Information System, otherwise known as BCIS. In addition, programs are required to obtain a listing of all employment held in the United States for an organization that provides care or services to children in the past 5 years for all prospective employees and take reasonable steps to verify such employment. A group size of 20 may now be exceeded during field trips for children, outdoor play, and activities organized by program staff if such activities are exclusively for school-age children, but may not exceed a group size of 30. And always staff-child ratios must be maintained. Next, head teacher requirements were updated to allow for experience gained in family childcare homes, childcare centers, or group childcare homes to qualify as a head teacher. Work homes must now have CPR certified staff on site during all operating hours. The OEC also, we no longer approve first aid courses. So there is a list of the organizations that their trainings are approved. One is the American Red Cross, also the American Heart Association, the National Safety Council, the American Safety and Health Institute, and Medic First Aid International Incorporated are all approved, as well as any course that we had previously approved prior to March 17th of 2018. For both first aid and CPR, the certification shall be based on a hands-on demonstration. This hands-on demonstration may be remote or in person or a combination of both. CPR certification must also be appropriate for the ages of the children served at the child care program. And verification of such needs to be kept on file for at least 3 years. Effective April 1st of 2025, all program staff shall have completed online health and safety training designated by the OEC. This is a one-time training. It is free and can be accessed through the OEC registry, which we're going to talk more about later. Staff hired on or after this date will have 3 months within which to complete the training. Staff are still required to complete the annual training that totals at least 1% of the total annual hours worked. and a list of all possible content hours for this training is included in the regulations. The new regulations also reduce the experience required for an early childhood education consultant with an associate's or higher degree in early childhood education, child development, or human development from 2 years to 1 year. The regulations also specify that the degree of the education consultant used in a program serving school-age children only may be in elementary education, after-school education, or other fields that specialize in the development and education of children ages 5 to 12 as recognized by the office. An annual review of policies, plans, and procedures that must be conducted by the consultants are now limited to just the services provided by that consultant. The need for all consultants to review all of the policies, plans, and procedures is another example of a requirement that was overly burdensome and therefore has been removed. The specific duties of the health consultant now also include a quarterly review of all injury, illness, and accident reports, and the specific duties of the ed consultant are now specifically listed in the regulations and include making annual visits to the facility, reviewing curriculum and daily plans, observing staff and children interactions, and providing feedback to the director and head teacher. And lastly, a dental consultant is no longer required by the regulations.
The next section we'll review is about record keeping. Programs must maintain documentation of incidents that are required to be reported to DCF and any behaviors exhibited by a child while at the facility that prompt the program to alter the way care is provided to the child. Programs must immediately notify the parent if a child exhibits or develops an illness or is injured while in care. In addition to injuries that result in a child's admission to a hospital, programs must now also report to the OEC diagnosed fractures, diagnosed second or third degree burns, and diagnosed concussions. Our staff have been working to make sure it's easy for programs to submit this and other required information through online forms submitted through the OEC website. And programs can find the OEC self-report form under the mandated reporting section of the forms page to report these incidents, along with significant medication errors and other incidents as necessary. Once complete, the form is sent to the OEC licensing division. This next section on health and safety focuses on food service, procedures in case of illness, first aid kits, and immunizations. One change is the required refrigeration temperature for perishable foods has been lowered from 45 to 41 degrees Fahrenheit to be consistent with the federal code that has been adopted in Connecticut. The regulations now require childcare centers that prepare food to maintain on-site a copy of a food inspection report issued by the local health department and make available to the Office of Early Childhood upon request. Programs that serve exclusively school-age children no longer need to separate the kitchen by a door or gate from rooms used by children. And the regulations now specify that at least one first aid kit shall be readily accessible wherever children are in care, including while on field trips. If children are outside, a first aid kit shall be readily accessible outside. Likewise, if all children are indoors, a first aid kit shall be readily accessible indoors. Water and liquid soap do not need to be in the first aid kit if that is readily accessible. And 2 triangular bandages with safety pins and a current first aid chart or manual are no longer required in the first aid kit.
Okay, moving on to the physical environment or physical plant. The regulations now specify that all indoor and outdoor space shall be inspected and approved by the OEC before it is used for childcare services. This was always required, but now the regulations specifically address this. The regulations also require that written permission from parents for the use of any space used by a program for a field trip at the same address as the program, but that is not inspected or approved by the OEC. Programs must make reasonable efforts to ensure children's health and safety while using this space, and parents must be informed that this space is neither inspected nor approved by the OEC. Another change is that programs are no longer required to have a designated toilet or sink for staff. When they do share toilets, then you do have to have a supervision plan addressing this. The requirements pertaining to window screening, electrical outlets, 4-foot fencing, and a few others no longer apply to programs that serve school-age children only. This is in response to a public act that had been passed several years ago, and now those are specifically in the regulations. A change that applies to new applicants, or if there's a change of location, includes lead water test results have to be taken from each drinking, beverage, and food prep sink. For licensed programs, water from at least one drinking fountain or drinking beverage and food prep sink, and from 2 such sources if the facility has more than one, must be tested every 2 years for lead content. Also, comprehensive lead tests are required for buildings constructed prior to 1978. This was previously a requirement also, but it's now clear in the regulations. The regulations now state that for programs serving children under 5, rather than 6 years of age, there shall be at least 1 toilet and 1 sink with hot and cold running water for every 16 children. Okay. Additionally, another change in this section is that backpacks, handbags, purses, or other bags belonging to adults or staff for carrying their personal belongings shall not be accessible to children. Programs have always had to have thermometers affixed to the wall, but the regulations clarify that they shall not contain mercury. Programs that serve exclusively school-age children don't have to have a thermometer affixed to the wall, and they may use space with a temperature less than 65 degrees, provided it is comfortable for children and staff. The regulations also now state that rugs shall not present a tripping or slipping hazard. Therefore, it's now possible that a rug that does not present a slipping or tripping hazard would not need to be secured to the floor. Programs must provide direct on-site telephone contact numbers to parents and the OEC at all times when children are present. A cell phone is sufficient, but it must be working and be answered by staff who are on-site at the program. The regulations also now allow for other equivalent measures of lighting in addition to candle feet. This is an example of where the regulations were outdated and needed to be changed to recognize other tools for measuring lighting. The regulations now allow programs that serve only school-age children to use areas with less lighting, provided it's bright enough to accommodate the activities with comfort, and sufficient lighting must be available to visualize children while napping and sleeping. This is required now. And the last slide on the physical environment includes that potentially hazardous substances and materials shall be stored in a labeled container, identifying the exact contents and dilutions, and shall be used according to manufacturer's instructions and for the intended purpose only, and handled in a safe manner. But the regulations no longer require that these substances and materials be locked, but they do need to be inaccessible to children. When cots are shared, wiping down the surface with a general purpose cleaning agent is sufficient rather than disinfecting. The regulation also specifies that indoor play equipment for climbing shall have a shock absorbing surface under and around that shall effectively cushion the fall of a child. And carpet is not considered a shock absorbing surface. Regarding shock absorbing materials on outdoor play space, the regulations now provide more information pertaining to when this is required and what may be considered acceptable. And lastly, the regulations now indicate when there is an accessible body of water, all entries and exits through a fence or barrier may be self-closing and self-latching devices if not locked. The regulations for barring children's access to bodies of water are more clearly spelled out, and the types of locks that are acceptable to bar access to bodies of water are specified.
Okay, this next slide is about the educational requirements of the regulations, and this touches on what is required for programs in their daily curriculum. The required content of the written plan has been modified and is specifically listed in the regulations. This includes the requirement for the program's plan to include opportunities for moderate and vigorous outdoor activity for children who are 3 years of age or older, unless the child has a disability or is experiencing a developmental delay, which prevents the child from engaging in that physical activity. The regulations specifically require the content of the daily or weekly written plan for programs serving children less than school age to incorporate skills across multiple domains. And finally, the regulations prohibit children from accessing mobile phones, laptops, computers, or other similar equipment, except for children 2 years of age or older when it is for educational or physical activity purposes. In this next section of the regulations concerning the administration of medications, non-prescription topical medications shall now only be administered in accordance with written parental permission. This was something that was previously strongly recommended but not required, and it's now a requirement. However, maintaining a medication administration record for non-prescription topical medications is no longer required. Any staff that will be administering medications must be trained in the methods of administration of medications that covers the general components listed in the regulations. They must also complete training on the specific route of medication they'll be administering. For example, if staff will be administering an oral, topical, or inhalant medication, they must complete general training on the methods of administration of medications and be trained on the administration of oral, topical, and inhalant medications. Likewise, if a staff member is going to administer an injectable medication by a pre-measured, commercially prepared auto-injector, which is an EpiPen, for example, they must complete general training on the methods of administration of medications, as well as specific training on the administration of the EpiPen. In this second example, a staff member would not need the training on oral, topical, and inhalant medications. The sample administration and medication training certificate has been updated on our website to make clear the modalities covered by a staff member's training. And finally, the need to submit a request to the Office of Early Childhood for a special petition for the administration of certain medications, such as a rectal medication and medications administered other than by a pre-measured, commercially prepared auto-injector, is no longer required, provided the general training on the methods of medication administration and training specific to the route of administration is completed.
On this slide, we will review some of the changes pertaining to caring for children under the age of 3. As you know, the regulations have changed the ratio and group size requirements for 2-year-olds. This new requirement is for a ratio of 1 staff member for each for 5 children, with a group size of no more than 10 for this age group, which is 24 to 36 months. Please remember, though, that when there's a mixed age group, for example, a classroom has both 20-month-olds and 26-month-olds, the lower required ratio for the age of the youngest child applies. In this case, the ratio would need to be 1 to 4, with a group size no larger than 8. The regulations now specify that furniture and equipment shall be used in accordance with manufacturer guidelines. And programs are no longer required to submit their plan for cloth diapers or training pants, if used, to the OEC for approval. The hands of staff and children are now only needed to be washed after each diaper change, but no longer requires them be washed before the diaper change. The revision to the regulations include the addition of requirements specific to the sleep arrangements for infants. These include the following: using only a crib mattresses that are snug fitting and covered by tightly fitted sheets. No items shall be placed in or hung over the side of a crib or other piece of equipment designed for infant sleeping, except for a pacifier without any attachments. This includes things like pillows, toys, blankets, as well as weighted blankets, weighted sleepers, and weighted swaddles. Bibs and garments with ties and hoods shall be removed from infants when placed to sleep, and no toys or objects shall be attached to sleeping or rest equipment. The regulation specifically indicates that no infant shall be allowed to remain asleep in a car seat, swing, or other places not specifically designed for infant sleeping. Swaddling is also now prohibited unless there are documented instructions and a time frame for which swaddling is permitted from a physician, physician assistant, or advanced practice registered nurse. It is now required that infants be physically observed while they're sleeping at least every 15 minutes. No child under the age of 3 shall have access to teething necklaces or teething bracelets when put to sleep. In addition, other jewelry that could present a choking or strangulation hazard is also prohibited while sleeping. And finally, the policies and procedures for sleep arrangements must be posted in the program so parents can see it, and shall document that the parents have been informed of the policies prior to enrollment and as needed during enrollment. In the school age endorsement section, there are not a lot of changes to this section, but the changes are nevertheless important to understand. The education and experience required for approval as a head teacher in a school age program have been reduced to require the completion of 45 hours of school age or elementary education training that's designated by the OEC, or a 3-credit course in school age or elementary education programming, and at least 240 hours of supervised experience working directly with a group of children in a licensed childcare or youth camp program or the equivalent. Previously, a head teacher needed 540 hours of experience over a period of 9 months, with either 12 credits in early childhood education or child development, elementary education, recreation, group social work or related field, or a 4-year degree in elementary education, recreation, group social work or related field, and 270 hours of experience. Given the short hours of school age programs that only operate before and after school, we understood that it's very difficult for programs to find staff with those credentials who wanted to work for just a few hours each day. So the new requirements reduces the burden placed on school age only programs, but still require some training and experience to ensure success in planning for these school age only programs. We'll discuss on the next slides what these new requirements for school age only head teachers look like, but first want to review just a few other changes. The ratio for school age children increased from 1 staff member for each 10 children to 1 staff member for each 15 children. And group size increased from a maximum of 20 to a maximum of 30. And finally, the regulations allow for the recognition of training and education of the ed consultant in elementary education, after school education, or other fields that specialize in the development and education of children ages 5 to 12, as recognized by the office. And this includes things like physical education, children's art education, children's music education, and human growth and development.
Thanks, Lori. Next, we're going to, as Lori said, we're going to look over the some slides about becoming a head teacher in a school age program. So individuals looking to become a head teacher in a school age program have access to the OEC registry once they have confirmed employment in a Connecticut child care program. For those without college credit, OEC offers free online training through the Child Care Education Institute, or CCEI, which is an online provider of professional development courses. The OEC has designated 25 hours of required training, which includes courses like school age development for ages 5 to 7, successful homework support for school age children, and general guidelines for a high quality out of school program. There are also 20 hours of additional training required, and individuals may choose from a list of 49 additional courses that meet their needs for professional development. Staff seeking their school age only head teacher certificate would log into their free OEC registry account, click the Head Teacher tab on the left side of the screen as shown. Following that step, you would click on the online training to click into the library of courses. In just 2 more steps, you click Courses on the left menu and then go to Course Catalog.
From the course catalog drop-down menu, choose School Age Care. You'll find the training from the list of OEC designated trainings. Complete the required trainings and then choose from the OEC list for the remaining hours. Completion of each training automatically shows in your OEC Registry Education and Training Report each night. Please do not upload certificates. The OEC auto calculates your hours and requirements. The final step is to apply. So just upload the completed teaching experience verification form, or EVF, to your OEC registry account under standard documents. Please be sure the form is complete, as denials are usually attributed to incomplete forms. After you receive the email that the form has been verified and education requirements are met.
So what's next? These revisions became effective on October 16th, 2024, and all programs must take immediate steps to comply with the new requirements. The licensing division has been working to update forms, documents, and sample policies and posting them on our website. The licensing database has been updated and our mobile inspection platform is nearing completion as we work to add new regulations and remove others. Licensing staff have been trained on these new regulations and have already provided technical assistance to several programs. By listening this morning, you've taken an important step in familiarizing yourself with the new licensing regs. Programs should also obtain a full copy of the regulations from the Office of Early Childhood website and read these line for line with all staff to understand the changes. A plain language summary of the changes has also been posted on the website. If you have questions that weren't answered during this morning's presentation, we'll be happy to answer as many as we can with the time that remains, but you may also reach out to the OEC Help Desk. That number is 860-500-4450, or better yet, reach out directly to your licensing specialist. The Office of Early Childhood will monitor compliance using these new regulations when visiting programs. When a program is found to be out of compliance with a requirement, several factors will be considered given the recent passage date of these changes. We'll consider the time that has elapsed since the new requirements became effective, what the actual requirement is, and all efforts taken by the program to comply when evaluating compliance. A program should keep record of all efforts made to come into compliance with a new requirement so that it can be shared with the inspector during an inspection.
So we hope this video has helped you become familiar with the changes to the licensing regulations. We thank you for your continued efforts to protect the health and safety of Connecticut's children. Thank you very much.
Right. Thanks, guys. Few quick things I want to just go over before we get into questions. Just a reminder that this was not for family childcare. This is for center-based and group homes. And so if you listen to that, amazing, you now know more. I'm sorry that those regulations did not apply to you, but we are also going to go over some legislative updates at around 10:30. So if you do want to stick around, that will be happening. I will post again the PowerPoint presentation. Understand also when it comes from OEC, sometimes in our process of translating, some of the images get a little funky. So if it's not as beautiful as the OEC's, I'm sorry, but the information is all identical nonetheless. And then just a reminder to folks that if you did miss any of this or you want to listen again, you can go to the YouTube channel, which is at Early Care Connection, and click subscribe. It's so much easier because then when the video is posted, you just get notified. You don't have to keep checking, but whatever you prefer, you can go there. We try to post within 24 hours. So those are all the things I'm seeing coming at me. I just wanted to answer all of those questions before we get into the real questions. Okay. So when when these went into effect, I believe in October. So I want to clarify that because someone's asking, so the sort of follow-up questions are has Connecticut made a decision about NIAC update, and will schools need to achieve accreditation plus? And it's okay if you don't know the answers.
Yeah, unfortunately, I can't answer that. I don't know.
So yeah, that is something that, we're in the works of understanding, right? And aligning with the national changes that are happening with NAUYC. And so we'll be able to get back to you all around some more specifics there.
Thank you. Okay, these are a lot of very detailed questions, but I think that's helpful because there's a lot of nuance here. In our garden, which is on the property, but outside of our playground area, is this an example of a field trip area that would need parent permission?
I think without seeing it specifically, I'm not sure that we can answer that fully.
Yeah, so this would be a question for their licensing folks.
Yeah.
Thank you. But I can see how my gears would be turning. I'd be like, okay, this isn't part of my thing, but sometimes we take the kids to the garden to look at a vegetable. How do we have to deal with that? I think it's good stuff for you all to think about and understand how people are thinking about it.
Right. If it's close enough to the property and can be licensed, and you want to take children there on a regular basis, I don't see why we wouldn't license it. But again, without knowing the specifics of the property, I don't think we can fully answer that this morning.
If you were previously allowed to be certified as an ed consultant with an elementary ed degree, will you be grandfathered in, or will your consultant certificate sunset?
I can grab that, Liz.
Okay, thanks, Margaret.
OEC is honoring all past education consultant certificates. So if you were already approved, we have a matching process in the registry that you can go through to link your registry account. And at that time, you can also make a decision to make some information public for the education consultant search function that we have in the registry.
Thank you. Please discuss the decision to eliminate tuberculosis screening and testing of both staff and children as it is recommended by Connecticut Department of Health, TB program, AAP, CDC, also the elimination of a dental consultant.
I think in terms of eliminating the TB testing and our screening, it was just something that we were not seeing a high prevalence of. It's certainly well within a program's own policies you can certainly still require it. It's just not a regulation required by the OEC now. Same with a dental consultant. We were not seeing a lot of programs utilizing their dental consultant. We also recognize that most children now have a dental home, if you will. And so having that as a duplication, if you will, of what a family may already have at home was not seen as necessary anymore.
Can we ask OEC to come out to assess our progress?
Well, we do have a technical assistance request form on our website. That's something that we've provided for years. So we can come out and do a walkthrough of your program, kind of a little mini inspection, so to speak. We also attend staff meetings. A lot of times a licensing specialist will come out once a year and speak to a program's staff to go over changes to the regs and just kind of give an update and review. So it's certainly something that you could fill out the form and request.
It's my understanding that staff who've completed CPR first aid only need to have completed the 5-hour course, not the 18 hours. Is that correct?
That is
Um,
correct. And we refer to them now as the all required topics instead of 18-hour because we removed repetitive or redundant content. So it is not that long. Folks can take as long as they need, but they will get credited for 18 hours. And then the partial required topics, that is correct. They will do that when they have OEC licensing approved first aid, CPR, and medication administration certificates uploaded and verified in their registry account.
Is there a plan to have the childcare additional piece of CPR and FA first aid be lifted and allow that approved CPR first aid trainings would suffice for Connecticut childcare programs?
I can grab that, Liz. So Liz went over, I'm not sure if it was Liz or Lori, went over the fact that now it is simply the pediatric or the ages which the program serves. In the registry, beginning back in October when the regs went into place, we started to address that and take anything that met those requirements. I do want to say, just as a shout out, if someone was denied for not having the extra content for first aid prior to when the regs took effect, just come back to us. We're totally happy to go back and take a look at that and swing it the other way. We apologize for that confusion. When the regs hit, and that's when we have to shift what we do. So just come back to your registry education advisor if you need help with that.
Thank you. Do we need authorization for non-prescription forms for non-prescription applications, things like sunscreen, chapstick, hand cream?
I think that was one of the things that we touched on maybe briefly in an earlier slide. We need parent permission for those non-prescription topicals.
Thank you. Have there been changes to outdoor space measurements? It seems that currently approved playground spaces are being decreased in number of children allowed in the space.
The 75 square feet per child remains and has not changed.
Great. Does the safe sleep policy need to be on a document and signed by parents? And do we need to post it in the infant classroom?
I would say the safe sleep policy needs to be posted wherever parents of children who have children enrolled in an infant room can see it. Whether or not you ask programs to sign it, it at least needs to be discussed, shared with parents so that they're aware of the requirements of the regulations pertaining to safe sleep.
If you have an infant, can it be in a common area for all parents, or does it need to be in the infant classroom specifically?
The regulations, I don't believe, indicated that it has to be in the infant classroom. We just, again, want to make sure that parents of infants are made aware of the policy, ensure that it's been shared with them.
For multi-hazard drill, all aspects, are we to practice the relocation of our students and staff?
Yes, that is part of the requirements of the multi-hazard drill, along with some of the other specific pieces like lockdown. So you might not, some programs might want to break it up and do one part of the drill, one time of the year and another part of the drill a different time. But you have to make sure that you plan for that. And when we come and ask, how are you reviewing and practicing these drills, that you have it documented, that you have done or plan to do the different portions of the drills.
For under threes, is jewelry only prohibited while sleeping or during the entire time they are in our care?
Jewelry is prohibited while the child is sleeping. The staff member needs to make sure that, they're obviously supervising children in case of any loose beads or jewelry, but it's prohibited during sleeping.
Indoor padding for climbing apparatus, thickness requirements or subjective, just not carpet?
For indoor climbing equipment, programs need to be following the manufacturer's recommendations if there's for specific padding requirements. So the regs don't require, like they do for outside padding requirements, but we do ask that you follow the manufacturer's recommendations.
If staff take professional development in person, should we continue to upload the certificates to the registry?
I'll grab that one, Liz.
Thank you.
So Laura, I'm not sure, I see that's from Laura Casey. I'm not sure the specifics of what you are asking. Right now, it is not a requirement for centers and group homes to upload their 1% annual training into the registry. They're more than welcome to under the non-verified training. Absolutely, it's a great repository, and the hours show up as your federal content areas on your education training report, which is super important. But it's not a requirement right now for centers and group homes in the registry. So just want to make that clear.
Thank you. Is it possible to have some of the registry training topics for school-age staff be presented in person to a group?
And I'll take that one too. So we are investigating how we might do that because it's based on individual competency. There is a quiz or exam after each module that an individual has to complete. So right now, obviously, the least cost to taxpayers is the way that we have it set up, but we are investigating that. Thank you.
Is there a time frame for how long the CCEI courses will be free?
I love that question. I'm going to keep going, Liz.
Take it away, Margaret.
So the OEC has made a commitment to having those offered for free. We renew the subscriptions every year. So we always try to catch it before you all get the notices that it's about to expire. But every July 1st, we renew, we track the use. And we're always super happy to see how many programs are using it, how many hours. It's a nice supplement to the professional development planning for your staff. So right now, there is no known end date. We have committed to it. It's a great place for us to also have the health and safety orientation components of the training in there. Please use it.
For inside climbers needing shock absorbing materials under and around, does this mean that the structure now needs to sit on top of the mats, or that these can be placed anywhere a child may fall or slide off?
They do not have to be, there's nothing in the regulations that require them to be right on top of the mats. Again, you'd want to follow manufacturer guidelines, but all fall zones would need to be addressed with some type of mat or padding.
Do we need to immediately call families for minor injuries like paper cuts or scrapes?
So the regulation is that illnesses and injuries are reported immediately to families. We do know that immediately does cause some confusion, and would just expect that programs will let families know as soon as it's, practically, as soon as it's realistically possible. We want to make sure that children's needs are tended to immediately, and then as soon as possible to let the parents know thereafter of an injury or an illness.
And that is for all injuries or illnesses, no matter how minor, like a paper cut.
I would say that programs may want to develop some policies about those situations in which they would notify a parent immediately, such as a broken bone, a fever, those types of things. The definition of illness has been included in our child care center regulations, so that's also a good resource in developing those policies.
Great. If my program has a school age after school program, do I need a second ed consultant with experience in that age group?
Margaret? Would that be you?
I don't think that
Or
that's
both
me.
of us?
Yeah, I don't think that we would require a second separate education consultant for a program that has all ages of children.
Okay.
And
Yep.
can I just add a clarifier to that? So I think, just to be clear, right now we have education consultants that are approved for birth to school age and for school age only. And so I'm not sure where in there, if you have the birth to school age, you've got it all. If you have only the school age, yes, you would be missing the birth to 5 component.
Qualifications for RD.
Not sure what that they're referring to.
Me neither. I thought you might. That one.
Is that the registered dietitian? I don't know.
Well, we'll ask for, whoever put that in, please clarify if you can. Yes, someone says yes.
Okay, so that just means a person who's certified as a dietitian nutritionist in this or any other state.
Right. Some of this is up to the licensor discretion. This is a follow-up to the garden question. Will they note direction provided in the school file? Oh, you're muted, Lori.
Sorry, we have instructed our specialists to document if a program is using space outside of their approved licensed space, document it in the comment discussion section near the end of the inspection form.
I'm sorry, I'm just rapid firing these because I want to try to get through. If you guys don't mind, we'll do 4 more minutes till 35, and then we'll cut it off there because I promised you'd get off. What is the requirement for staff administrating insulin to a child? Do they need specific approved training?
Yes, there are specific regulations about staff training for a child who needs insulin. I can put that in the chat, or I can answer that separately.
Yeah, chat would be great. We'll keep going. For a program that does not serve food, to collect a lead sample, will we now be drawing a lead sample from 2 water sinks? Is it all water sinks, I guess?
Drinking or food beverage.
So if it doesn't matter if they're serving food, if the children drink out of it.
Yes,
If the children do not drink out of it,
then no.
no, thank you. Let's see, the low soft infant climbers questioned about whether they need the shock absorbing material. Is this also manufacturer's recommendation?
Not sure what a low soft infant climber would be. If it's a piece of equipment designed for climbing, if they're up off of the floor, then it's possible, but they definitely would need to follow manufacturer guidelines.
Great, thank you. Can the April 1 date for required additional training, the 5+ hour online training, be extended? This requirement places a financial burden on schools that have not budgeted to pay their staff for this time, and a time burden on current staff that are already overworked. That might be a comment more than a question, but if you can answer it, you're welcome to.
I can answer. I would say, unfortunately, the April 1st date is set in the regulation, but as we stated earlier, we definitely will take into consideration, any efforts the program has made toward complying with this regulation. Licensing specialists during inspections will also be providing technical assistance if programs are having trouble getting registered with the registry. If they don't have an account, we will certainly be working with programs to make sure everyone understands how to comply.
And listen, for OEC folks who are here, if you guys can look in the Q&A, I think there's a lot of questions that are yes, no, simple ones. So if you're not the person who's answering questions with me verbally, maybe the other people can jump in and do some of those. That would be amazing. Can the field trip permission slip be a general form giving permission signed at the start of the year? Or does it have to be each time we leave the site specifically? Like if you're always going to go to the garden often during the year, you're going to do a field trip once a week. Can a parent sign off for the year, or does it have to be every week?
I think it could probably be once a year, but if this is going back to the question about the garden outside of licensed space.
Assuming it's a field trip, let's just assume
Uh-huh.
licensing says it's a field trip.
Yeah, I mean, having the field trip, they would want to let parents know when they're going. If they're going to a place over and over, we may go once a month, but certainly letting them know when they're going if they're off site. They're off the property.
Someone is also in the chat asking for you to share the diabetic children, info on diabetic children, requirements for staff, and also a list for registered dietitians, if that is something that exists. For jewelry, do pierced ears count, or is this just bracelets and necklaces for under 3s?
I'm sorry, can you, I'm trying to multitask, Izzy. Can you say that again?
Sure, sure. The jewelry, is it pierced ears also, or just bracelets, necklaces?
I would say, so the regulation specifically says that children under 3 should not have access to teething necklaces, teething bracelets, or jewelry that could present a choking or strangulation hazard.
So infants who have their ears pierced, or, young children, that's fine.
Fine.
Okay, we are at time. If you all want to stay on like 1 minute and just answer the last remaining questions, I'm actually going to turn off the question right now. No one can ask any more, but if you guys can stay for 1 minute and just, there's a lot of yes, no's in here, we could probably get those answered really quickly.
Sure.
Thank you so much. I know this has been something that a lot of folks have been asking for. If there's follow-up needed, we'll get back to you. Otherwise, does it help you all if we send you this list of questions, or because you've heard them, you're okay?
Yeah, if you can send them to us so we make sure that we get everything and have responded to everyone appropriately, that would be great.
Great, we'll do that after the call. I'm not sure if you guys had any closing remarks before we wrap up. No, okay, great. Well, thank you all for being here. Thank you, Commissioner Bai, for being here. Thank you to the entire staff. We're so appreciative, and have a wonderful week. We are going to move on to talking about some legislative advocacy opportunities that are being presented this week. And so I'm going to, oh yeah, folks are going to be upset if providers start removing earrings. I think you're right about that. And and I think that's a really good comment. So but moving on, I'm going to invite Ava and Meryl to let you guys know about some public hearings and other things that are happening this week. I guess I'm turning it over to you two in the order that you'd like.
Thank you, Izzy. So for those of you who are eager to share your story for tomorrow's hearing, there is a hearing. Okay, let me backtrack. There's a hearing tomorrow. 'Tis the season of legislative session and having hearings. I know many of you have been on our calls where we've expressed the importance of you sharing your story, your perspective as an educator, a director, owner, operator, the difficulty the job comes with not having funding, the difficulty of trying to maintain your space, all of the above, all of those hardships, the crisis in this system. Tomorrow is another opportunity to share those stories in person or via Zoom. The bill that will be heard, or the two bills that will be heard, are HB 5003 as well as SB 6. So this is through the Children's Committee. The hearing itself, it starts with a press conference at 11 a.m. Held by Speaker of the House, Matt Ritter, Representative Ritter, as well as Representative Kate Farrar. In conversation with her on Friday, she said she welcomes any provider, any parent who would want to be there and see and be, in support behind them for the press event at 11, and then the hearing starts at 1 p.m. If you do want to share your story via Zoom, or if you want to share your story in person and testify, the cutoff to do that is today at 3 p.m. Again, today at 3 p.m. If you want a heads up and, a little bit more support because you're super busy with the kids, you have meetings with your staff, we do have a sign up through Childcare for CT. And if you sign up through Childcare for CT before 2:30 p.m., we will assign you a staffer that will text you, every 30 minutes, giving you a heads up where they are in the list. And then that way, when it's your turn, we give you that heads up, you jump onto Zoom, and then you're in and you're out quickly, rather than trying to navigate the system all by yourself. So it's really up to you. If you do want to testify via written submission, right? You don't want to go on Zoom. you do not have the ability to go in person, which everyone understands that, and you want to submit something in writing, I will pass it over to our partner here, Meryl Gay, who did a wonderful toolkit that really walks you through.
I'll give credit to where credit's due. Vanessa did this. We just stuck it into the chat. It's in English and in Spanish. Let me back up a step and just kind of quickly summarize the bill so that everybody knows what we're talking about. This bill would appropriate $100 million to the existing early childhood fund that was created last year. It would then direct OEC to do a cost analysis to show how to or what it's going to cost to raise rates and expand eligibility for Care for Kids. Actually, no, that's about provider rates. And then it would raise rates for Care for Kids from 50% of, or not raise rates, raise eligibility for Care for Kids from 50% to 85% of state median income. And it sets up a healthcare subsidy program for early childhood educators to make it easier for centers to offer care, offer a health plan to their employees with a subsidy to help offset the cost, or for early educators who are self-employed, a way in which, or early educators whose employers don't provide healthcare, for them to be able to get a subsidy to buy into a decent health plan on the exchange. The other thing this does with Care for Kids is it would say that early educators who use Care for Kids would be exempted from a parent fee. So any early educators working in your center would be able to get care without having to have a parent fee. The state would pay the full cost of the full Care for Kids allowable cost. It also sets up funds money for the pre-development work for competitive grants for facilities, and allocates $100 million in bonding to fund facility expansion and renovation. With Care for Kids, it also sets up a system of presumptive eligibility so that you don't have the situation of people who aren't eligible sitting on wait list for a long time, and makes it so that families who are 95% likely to be eligible for Care for Kids could actually start care while the paperwork is getting processed. It requires OEC to come into compliance with the federal rules on prospective payments, so that rather than waiting for a month to get paid by Care for Kids, you would get paid in advance, like your private customers. Let me just see what else is here. It requires a study on liability insurance costs, because we're hearing over and over again that that's a problem, as well as a study on why men are underrepresented in the early childhood field, and a study on improving the background check system. So all of that comes from the summary that I listed up higher in the chat, and I think you can also see through that toolkit.
Carl, there's a question. Someone wonders, I have not yet read the bill. Are there guardrails on the types of programs that will be eligible for grants?
So yes, the grants are for capital improvement, like building a facility or renovating a facility. And this bill allocates or authorizes $100 million to be used for that over the course of the next 5 or 7 years, I don't remember. And specifically says that some of the $100 million that's approved for to go into the early childhood fund, that some of that money, in addition to being used to expand Care for Kids, can also be used to help pay for the technical assistance and pre-development costs for people who are applying for a bigger bond-funded construction project.
There's also specifications for who is approved for the grants, where they lay it out, the priority first. The first people who are going to get the grant are people who could establish great need, like they really need the help. And they also spell out people, owner operators in spaces that operate in areas, or are going to be operating in areas of deserts that there's need in the community. So it doesn't explicitly cut out anybody, it just prioritizes those two categories in the grant conversation. I guess lastly I'll add, because I know people have been very patient, it's a long morning here, that if in your testimony you could emphasize once more, and I know most of us do this every single time, every single year, we need more money. So the 5003 has some awesome things, the health insurance, the program subsidy, all good stuff, all things we've discussed. But 100 million maximum in this bill is not enough. And even if they use all of that 100 million to pay for the grants, the healthcare subsidy, the expansion on Care for Kids, they're already going to put folks back into a wait list with that expansion. So we want the money, we want the programs, we want these opportunities. I would just ask that if you have, the ability to emphasize in your testimony, funding, then go for it.
Yeah. This bill lays out some good things. The real challenge is that there's not enough money there. The difference between this bill and the governor's bill talked about taking $300 million in unappropriated surplus and putting it into an endowment, and then each year putting more money into an endowment and being able to take out 10% of the money each year to use to expand preschool. This bill says we're going to take $100 million out of the unappropriated surplus, put it into the early childhood fund, and we could spend 90% of it each year on those allowable expenses. But so that would mean $90 million to expand Care for Kids, to provide healthcare subsidies, to provide money to help with the pre-development work for facilities expansion. We'll go through that money very quickly. That is the challenge. So yes, please ask for more money in your testimony.
Is that it?
Happy to take questions about it.
Excuse me. I'm having a hard voice morning this morning. My apologies. Anything also on next week? Meryl, did you want to just talk about what's happening here next week?
Yeah, and we'll come back to SB6, Eileen's question afterwards. Next week, we've arranged.
And SB6 also.
Yeah.
I was wondering that.
Danielle Ewing from Ed Consult or Education Trust. I'm trying to remember what exactly the organization is. She's our national expert that we turn to for what the heck is going on in Washington right now. The news out of DC is just like trying to drink at a fire hydrant or a fire hose at this point. Every day there's more and more stuff. And the negotiations over a budget are ongoing. You may have seen that the House of Representatives approved a budget reconciliation deal, which sets top line numbers that then committees have to work with, that in order to deliver the $4.5 trillion worth of tax cuts for very wealthy people, they will slash spending on a bunch of important things, particularly Medicaid and SNAP. but Danielle can fill us in on the latest details. That's going to be next Monday. That session will not be recorded, so plan on watching it in person.
And then someone is also asking about just requesting, I guess, that you guys let folks know when a bill has made it out of committee, if there's updates like that. I don't know if that's also something that I would guess the usual line, you should get on the email list for the Early Childhood Alliance and Childcare for CT, because the most up-to-date stuff is going to be coming out of those email lists. But every Monday, we will be sure to be giving an update on what happened the week before.
Yep.
So it's Childcare for Connecticut. I'll put these both in the actually Vanessa will
Okay.
put it in the chat, I think, for yeah, we'll put these in the chat for you guys.
Okay, and then Senate Bill 6 includes a number of, it sort of seems like a number of disparate things put together into one bill. So there's a big section about data and trying to improve the system of tracking kids' developmental screenings, etc., and getting kids their state school IDs assigned earlier, like as soon as they encounter the birth to 3 system. There's also a section that talks about pre-kindergarten academies at public schools. It looks like it is a rewrite of the Smart Start bill to provide school districts with grants to provide sort of a early kindergarten for the burr babies, another year of preschool, essentially. It seems to me like the other 2 bills, the governor's bill and 5003, kind of have this covered, and we don't need to have another grant program to public schools to open up new pre-K. But I'm sure there are other people who have different opinions on that.
Angela, it wouldn't lower the age. I saw someone, Angela came in with, would this lower the age? SB 6 wouldn't mess with the age requirements. No. And then another question about SB 6, or I guess both. Should you testify for both? How do you do it for written and in person? You technically can. There's not a problem doing it because it's the same committee. So if you want to submit something in writing saying, you know, my name is Jane Smith and I support HB 5003 and I support SB 6, and then put your personal story, totally okay. Same goes with the live testimony. Again, it's the same committee. So it could be, you know, distinguished members of the Children's Committee. My name is Jane Smith. I could just say my own name, Ava Bermudez Zimmerman. I really support HB 5003 and SB 6. And then in person, you know, I'm sharing my personal story. That's okay. There's not a problem. If you just want to do one because you feel, you know, you're reading the fact sheets and you're trying to get a better understanding of what's happening, you feel more connected to one proposal versus another, that's okay too.
Yeah, and if you want to talk about a particular section of a bill that you support, you can do that. I would generally suggest that if you're submitting written testimony, that you not lump it all together into one document, but do 2 documents, because one of the things that legislators will do in a hurry is click on the bill, look at the supporting and opposing testimony. And if everybody submits their testimony under 5003, they don't see any testimony on Senate Bill 6, and they sort of wonder, you know, okay, I guess nobody cares about that bill. So just, it doesn't have to be long, but if you're going to do testimony, I know that there are people who will put it all together into one piece of testimony, but it's not hard to separate it into 2 and upload it separately for each bill. If you are testifying live, either on Zoom or in person, you only get 3 minutes. Doesn't matter how many bills you're talking about. So you would just want to mention quickly if there's a bill you support, I support this bill, and I want to talk mostly about this other bill. But that's the way to do that.
Do you see Joanne's question? Have any
Yeah,
legislators
I-
proposed moving the exception process for children who have birthdays where they turn 5 after September 1 and miss the new kindergarten cutoff?
I haven't seen a bill that does that. It's possible there is one, I've missed it, but I don't know of it and don't think that there's anything under.
I think Meryl, in one of our caucus meetings a few weeks ago, there was discussion about it, but I agree with you. I haven't seen it. And Joanne, to even be more specific, and because you're very engaged, you are not missing a beat here. You got your thumb on the button. You know what's going on, and sadly, no, there's no traction, and there hasn't really been a conversation within legislators that we know of trying to push something like that forward.
I'm sharing 2 different documents. Frank was asking if there was any generic written script that does exist. I believe that exists in both of these kits here, right? So you can click on those and it
Yeah,
sort of walks you through the process of submitting.
In our kit, it's way at the end of it's the actual sample testimonies at the end.
Is it more impactful for people to testify on Zoom rather than in writing, or is either okay?
I would suggest, regardless of whether you testify on Zoom, submit written testimony. So even if it's just, I think I'd like to testify on Zoom, you want to write down what you're going to say. So put that into written testimony and submit that. If, for instance, the hearing goes really long, or they get to the point where it's your turn to call, but your turn to speak, but you've got a crisis out in your program and you're out there and you miss your turn, nobody's going to hold it against you. They'll still let you testify the next time. But having your written testimony in makes it their part of the record.
And if you want, yeah, and I'm just about to put in the bit.ly link actually has it's like one of those things where it just takes you through the process. So basically it's all already in there. It makes it very, very simple. And so the toolkit has all the information you need on the bill. The bit.ly link is sort of the place where you can actually just fill out a sample testimony and then that gets sent in. So that is very easy to use. Ava, go ahead.
Just one last point to make with this particular hearing happening tomorrow. If you do plan on testifying on Zoom or in live in person, we don't anticipate it to be 12 hours long, because this particular hearing only has 5003 and SB 6. Typically, most of you who have testified in person or via Zoom see that you might be number 100 or number 250. Especially when we were in the education committee, or if there's 7 other legislative bills that are going to be discussed, then we're competing with time with 6 or 7 other topics. Because this is just early care tomorrow, we expect it to go much faster. And if you're scared of signing up because you don't want to have to testify at midnight, I really doubt that would happen.
Yeah. All right. Thanks, everyone. So just to reiterate, we will be doing a weekly legislative update here every Monday. If you want the news faster than that, join those email lists, but we are committed to giving you guys a legislative update every week. So just know that that is there. Okay, I think we're all set for today. Thank you to everyone who helped today. Thank you to Sandra for providing interpretation for us. Ava and Meryl, as always, thank you for keeping us up to date on everything important happening in the state in early childhood. And as always, thank you to Commissioner Bai and the team at the Office of Early Childhood for coming on to help us understand all of these new regulations. So, oh, wait, of course, most important, thanks to this amazing community who shows up every week and makes these calls relevant and important. So have a wonderful week. I hope everybody that it's easy and smooth and joyful and that the weather's nice for you all. All right. Have a good one.